physical therapist on the internet.
Hi, folks. I'm Bob Schrupp, physical therapist.
Brad Heineck, physical therapist.
Together we are the most famous physical therapists on the internet.
In our opinion, of course,
Very
Bob.
delusional. Today we're going to talk about, is it time for you to get a knee replacement? A lot of things to keep in mind, and we're going to present you with some of the questions you should ask, and maybe this will help you come to an answer.
Sure. Yep.
First off, just because you have knee arthritis, it does not mean it's going to get progressively worse. They've done studies that have shown that knees can stabilize and even get a little better. Mm-hmm. So don't assume that, oh, I got arthritis, I'm going to have a knee replacement anyway, I might as well do it right now. Not necessarily. So let's, first try physical therapy, and there's anti-inflammatory drugs and shots, and there's all these things you can try.
Right, there's these, supplements. They're a little not confirmed yet, but whatever. There's things that diet-wise that may influence it. It's,
right.
It's not going to make you worse anyways.
Yeah. So if you've tried the conservative approach and you're still experiencing some of the following issues, you may want to consider knee surgery. So the first one, you require pain medication just to get through the day.
Yeah.
That's getting tough because that's a downside in itself. Especially if the pain medication is a stronger pain medication.
Right. There's side effects to those that can be worse.
Right. You don't want to stay on an opioid for any length of time.
No.
So if it's really interfering with your life, like, it's preventing you from sleeping, that's when it's really starting to go bad.
Right.
If you can't walk upstairs, you can't get out of this chair very easy or the bathtub.
If you can't work because of it.
Yeah.
Well, that's obviously something that we got to take care of.
Right. Okay, number 3, your knees are stiff and swollen, like you get in a car or sit in a movie theater and you try to get up and you can't even get out of the building.
You're stuck. Yeah.
Right. And, it's funny, I having my mother-in-law and stuff like that, and, you can see why they start limiting the things they do, because they, we just were recently going to take her to a restaurant, and I don't think she wanted to go because she was worried that she, getting in and out of the restaurant.
Right.
Without,
painful, limping.
Right.
Don't want to be seen looking like you have a problem, which you do. So, yeah, that's definitely a consideration.
This is a knee replacement issue, but number 4, if you had a knee replacement, if you had a knee injury, like athletic injury, and your knee is deformed, or if you're born with a deformity, surgery may be a good option then.
Right.
So,
yeah, especially, if you have valgus or, you knock-kneed or bow-legged, that actually can be sometimes corrected completely straight or at least improved from the surgery.
Right, exactly. The other thing is if you had a previous like ACL tear, so like if you tore one of the major ligaments on your knee, it's going to wear out quicker. It tends to wear out quicker because the support's no longer there. So
right. I mean, so assuming you didn't have it repaired.
Right.
Mm-hmm.
Right. When your knee hurts, even at rest, it's starting to become a sign that you may need to have surgery.
Right. And if movement, you try therapy and it doesn't seem to improve or makes it worse with the appropriate type of exercises, that's a good sign that it's time.
This next one I think is a lot more common in our generation now, Brad, is that we want to stay active.
Sure.
I mean, just because we had knee arthritis or knee pain, I still want to hike and bowl and ski and run and all those sorts of. You're very active. You just did a triathlon.
Right.
For God's sake.
Yeah, for God's sake. But I remember skiing out in Colorado. We had a ski vacation, and I'm going up, and this is at least 10 years ago, going up the big one of these lifts that hold 4 or 5 people.
Yeah.
And here's a guy, he's in his 60s, and I was talking to him. He says, I just had my knee replaced a few months ago.
No kidding.
Yeah.
And he was going down there.
Yep. He wasn't doing jumps. He was obviously a good skier prior. He wasn't learning. So, he just wanted to keep skiing.
Well,
so
Brad and I were talking before this video, actually, and I just saw these were ads actually in Forbes magazine. Mm-hmm. So I think they're legit. But this guy, he wanted to get back to running after his knee replacement, and he wanted to run a 100-mile race.
Yeah.
His doctor said,
Really?
So I don't know if that's always the case. I don't know the latest on surgeries right now. We're trying to get a surgeon on our show.
Well, yeah, that is a quite of a.
That's
Just going back to running is typically, from my experience,
right.
not advised.
Exactly.
But maybe with new technologies, or maybe the
so.
surgeon was an unusual surgeon. I don't know what
Right.
to say.
So this next one, I always ask people this: are you just sick of it? Because there's people that you can start affecting your mental health even. Like you feel like sad and hopeless because you're having knee pain and
Right, you're just spiraling down.
Right.
It's time to get after it.
Yeah, and a sign of that quite often is you put on weight or you lost weight. One of the two can indicate that your mental health is declining, and so consider these additional points. Most of them joints, artificial joints, last 10 to 20 years.
Right.
So
I've worked with people in their 80s or 90s that they've had a knee for 30 years.
oh, really?
Yeah, I mean, so that I think
that's the average.
Yeah.
It can go less, it can go more, and depending how much stress you place on it.
Sure.
I mean, if you do not place so much stress on it, if you're running 100-mile races, you may
Maybe it
you're
might
gonna be at the low end, yeah.
Or like that Wim Hof guy, he's
The women,
deadlifting 700 pounds. It's like, remember that picture, Mike? You know that.
Kelly Starrett, not Wim Hof. It was Kelly Starrett from the Supple Leopard.
He was.
He deadlifted weight after his knee replacement.
Yeah, and he's a PT, so
Yeah.
it shows how much I'm going to listen to that.
Yeah, exactly.
I thought it was Wim Hof for some reason. Anyways,
Another thing which you really have to keep in mind, if you're not a healthy person, you may want to have the knee surgery sooner than later, because
sure.
I've seen a lot of people that waited too long and they didn't pass their physical then, and they said, no, you can't tolerate surgery. And surgeries are tough. I mean, you lose a lot of strength, endurance, and you're going to have a harder time returning to normal activities.
Right.
So, keep it in mind, it's easier to tolerate these surgeries when you're a little bit younger than when you're older.
Sure.
So
Yep.
my mom had 2 knee replacements and not at the same time, but the first one was a lot easier. She was only in her 80s at that time. The last one was in her later 80s. So
I had a patient. His second one for sure was that he was like 92.
I had a hip patient in the 90s.
Yep. So it's not common, but it certainly is.
Yeah.
There.
All right. If you want to check out our entire program on knees, go to bobandbrad.com, go to the program section, and look for the one on knees. And we have a whole series of videos how to treat knee problems, specific knee problems.
Right.
And after you've watched the video, you can actually print out
a PDF.
Yeah.
And Mike was saying you don't have to print it out, but you can do a screenshot or whatever, and there you got it with you, and look at it so that, little reminders. And there's absolutely no cost. It's not even an email is asked.
That's right.
Which is pretty rare.
We ask very little of you.
That's right. Good luck with your knee, and we hope everything turns out wonderful.